to our next Digital Medicine's Professional Interest Group meeting. Just a note to say that Ben is recording this meeting, so I hope that that is okay with everyone. And just to kind of make you aware of that, but it is just being used for internal purposes, just so we get kind of accurate reflection of what's captured in this meeting. I hope everyone saw the agenda that was circulated yesterday. So essentially just a quick introduction from myself, and then essentially the bulk of this meeting will be an update from the various work streams. So an update from workstream 1, which is around the networking, and that's headed up by Glenn. Then an update from workstream 2 around optimizing EPMA, which is headed up by Ramandeep and Joseph. Then an update from workstream 3, which is around safety, and that's headed up by Jono. And then lastly, an update from myself on workstream 4, which is around that pathway to CCIO. And then just closing the session with some next steps and any other business. So I hope that sounds okay with everyone. So I will just start things off with a quick kind of like introduction and welcome. So I think most of you have already been on have already sort of attended these meetings before, but I also know that there is quite a few people who are new to this group. So for everyone who's new to this group, welcome. Hope you really enjoy being part of our group. As I mentioned, we have got those 4 work streams. So if you are interested in becoming a member of any one of those particular working groups, then please feel free to kind of drop me an email with the working group that you would like to be part of, just so you can work with the sub-lead on that in more detail. I know that the sub-leads are always really grateful for any additional help that they can get. So if you are interested in any one of those 4 work streams, then please do let me know. Second of all, just to say that I think most of you should now all have access to the Teams folder and the Teams files, which is where we store everything. Again, I know we've had quite a few people and quite a few influx of emails where people didn't have access, but I think we've captured all of those now. But if there are any outstanding people who still don't have access to the Teams folder, and please get in contact with me, or you can get in contact with Ben directly, and we'll be glad to kind of add you to the Teams folders. And that's particularly important for people who are part of those subgroups for workstreams 1, 2, 3 and 4, because a lot of the documentation is stored in the Teams folders, and that's just because it's simply much easier to work on a document that's stored in Teams rather than back and forth emails, which I'm sure just add to our ever-growing email inboxes. So yeah, so please feel free to kind of drop myself or Ben an email if you don't have access to Teams. So that's all I wanted to say by way of kind of introductions and welcome. So in that case, what I will do is move on to the first update, which is from Glenn on workstream 1. And I know that Glenn said that he might have trouble joining, so he has given me a few words to say in terms of an update, but I just wanted to check. Glenn, are you online at all? Are you attending? Just check the people. No, okay. I don't think Glenn has managed to join, but not to worry. He has provided me some lines and a short summary, just to kind of update everyone on workstream 1, which is the networking update. So his update, let me just get that on screen. Okay, fab. So from Glenn's point of view, he said that the last time that the workstream met up was in March. So if there is anyone who did want to join workstream 1, feel free to email myself or Glenn directly to join that workstream. He's mentioned that an invitation was sent out to Di Bullman from NHS E&I for collaboration, as they were also interested in national networking for their digital learning framework workstream. And during the meeting, it was agreed that the database would be split into country and then regions, and that we needed to be mindful of overlap and duplication of work by other groups, such as NHSD, the Ccio network and supplier user groups. Glenn's also mentioned that sharing of the database was also discussed, and it was decided best to share this database centrally because not all contributors were members of the FCI. And it was also agreed that the FCI workstream would collaborate with NHSD and NHS E&I to create the database. And there is ongoing discussions with NHS E&I about hosting the database centrally on the new digital learning network, and that's something that's in development at the moment. So in terms of further development for the database, so there's a couple of points here. So the first is that they're hoping to expand contacts to capture the wider healthcare system. So that might include primary care, CCGs and ICSs. The second point is there's also a desire to include other healthcare professionals that have an interest in digital medicines. So actually they might not be kind of pharmacists or pharmacy technicians, but they might be, for example, like nurses who are working, but actually they have an interest in digital medicine. So they would still be it would still be kind of great to include those within the kind of network. There's the addition of supplier user group contacts, which I think Glenn has already started, and there's sustaining and maintaining this database going forward. So they're kind of 4 key points in terms of further developments for the database. And then in terms of updates on the work so far, so Glenn's kind of split this out into a few different phases. So for the first phase, it's around gathering a variety of different contacts, and Glenn's already used Twitter and he's used the digital transformation events, which I'm not sure if many people on the call attended, but there was essentially kind of like a board that was used there to kind of capture different thoughts for people who attended that event, and that was really to gather a list of contacts. So that's kind of already happened. And then phase 2 of this is around expanding the database to capture granular information on what EPMA or EPR system each trust has and what expertise can be offered by individuals and trusts. So Glenn's working with Ansley on that, and Anne's sending out a national EPMA survey to capture this data. And NHSD have agreed to share this data with us once it's collated. And I believe that the survey meeting is happened this morning, actually, just prior to this group. So so apologies, I realised I probably talked a lot in that, but I just wanted to kind of give everyone a quick snapshot of some of the work that's happening in Workstream 1 that Glenn's leading. And specifically, I think Glenn's asked to this wider group is that, as you can see, there is quite a lot of work that's going on in this area. And at the moment, there's only two people in Glenn's subgroup. So it really is a plea just to this wider group that if anyone can join and help Glenn with that, the support would be really much appreciated. And actually that networking work stream is kind of pivotal to all of the other work streams that we're doing and all of the work that we're doing, because it's all about that connectivity and sharing information against systems. So yeah, so that was kind of really the plea there. Shazad, I can see you've got your hand up.
Thanks, Amita. Stefan, thanks for mentioning the HSN event. Steph and I were leading on that event as part of the work with NHS Digital, and we kind of had this thought that maybe it'd be useful for, as you mentioned, to just connect the people, so that way we know which organizations are with which supplier, and in what stage they're at, whether it's procurement, whether it's implementation, whether it's optimization. So thank you to everyone who's actually contributed and actually managed to establish and convey that information. I think there were some people who put the information down, but didn't actually say which organization they were from. And this is all part of the learning. So I think one of the overarching messages that we got from everyone on that day was, this is great. We love the fact that we can network. We love the fact that we can learn from each other. And so, yes, please, can we understand who is using, which organization is using which system, but also what stage they're at. And also, would they be willing to share those learnings with us? So I think, yeah, just to re-emphasize that if we could do that within this network as well, that would be much appreciated. And I think also within NHSD, E and I, whatever the acronyms are these days, we're also looking to set up like a clinical care group as well, like a network. So as part of disseminating that information, these are the thoughts we have in terms of what we want to do, who's able to get involved. Steph, do you want to mention anything else that I might have missed?
Yeah, so yeah, just to pick it up on that. So yeah, trying to hopefully relaunch a platform where we can share networking ideas. So with the feedback from the PERM survey, the survey that has gone out, I think this week, and using that as well as the different contexts we've got with the masterclass and what we already have, is trying to again create this platform that people can again share their ideas and say exactly where they're at, and have again this database exactly where people are, so what suppliers, who they are, and if they're willing to help others and willing to share their ideas. But I think Andrew's got something to say.
Thanks. Thanks, Steph, and thanks, Shazad. I know you've both been working really closely with Glenn on this, so really appreciate kind of all the work that's gone into that. Yeah, Andrew, you've got your hands up.
Yeah, sorry, I haven't attended this for a long time. On the survey that's being collated, are we also aiming to record the data provider for those systems as well? So whether they're using Multilex, Multum, or another data set? If not, it might be something worth us looking at adding in at some point, because a lot of those systems, just to get, I guess, more developed, they rely on data imports from those services, and that's underpinning a lot of the D+D work, and will probably underpin a lot of the interoperability work as well.
Thanks, Andrew. Oh, yeah, I was just going to say, Shazad or Steph, do you have anything to add in response to that?
So we haven't gone into that level of granular detail to ask that question, because we know that like the likes of Cerner use Multum and the likes of Allscripts use FDB, etc. However, yeah, I mean, if you can convey that information, by all means, I think it's a really good shout, Andrew. So definitely welcome it. And I think we're going to have further engagement with the suppliers as well to understand, what databases they have, but also if you're able to convey that, whether there's any differences between what's available, what the options are, again, that would be useful, because I know that when we did an implementation, we could use Multum, but we could also use the likes of LexComp as well. So again, it's probably a good shout. So yeah, this is exactly the kind of feedback we need. Steph, I don't know if you've got any other thoughts on the matter.
Yeah, I was going to say that's great. I didn't, like I was saying, I don't think we've gone into that much detail, but again, this is like the beginning stages. So hopefully be able to build up upon, once we've got the data, we can add, and feel free for people to add onto it and build up. Again, this is iterative, we're just starting now. So yeah, happy for any other feedback.
Fab, thank you. Thanks, Andrew, for the question, and thanks, Shazad and Steph, for the kind of additional information. Were there any other kind of further comments or questions around Workstream 1 and the networking group? No? Okay, fab. And what I'll do is Glenn said that he's happy to take questions as well. So I'll pop Glenn's email address into the chat box if people wanted to connect with Glenn directly after the meeting. I will pop his email address so people can drop him an email directly. Okay, in that case, shall we move on to the second agenda item, which is an update from Workstream 2, and that's around optimising EPMA, and that's headed up by Ramandeep and Joseph. So I'm not sure which one of you will be leading, but I'll hand it over to both of you.
Thank you, Amita. Good afternoon, everybody. It's myself that will be presenting, although Joseph is also on the call. So if there are any questions at the end, we'll be happy to take them together. What we're going to discuss is our Optimising EPMA workstream, which is workstream 2. I'm going to share my screen if that's okay, Amita. Just bear with me 1 second. Hopefully everyone can see this. In essence, the remit of this group was to look at how we can go about optimizing EPMA and how we can progress some of those discussions within this area. Bearing in mind that EPMA is either rolled out across everywhere or due to be rolled out across each organisation over the next, hopefully, I should say, couple of years, but I'd like to think it was much sooner. But I know that's definitely not the case everywhere. So this group started very much at the beginning of the year with a very different focus when we first started, and there was a number of conversations that occurred as to what we wanted to cover within this group. And then we kind of realised that some of that work was going to overlap with the networking group. So we've taken pretty much a 360-degree turn really on where we were and thinking we were going to take this group from the beginning. And then we've changed that relatively recently in the last couple of weeks. And what we've done is we've built on a piece of work that was planned by Amita and Jono in terms of workstream 3, which you'll hear a little bit more about shortly. And we've taken some initial ideas and then created a draft document that you can see on the screen, which incorporates where we feel that we can support the optimising EPMA sort of work stream and piece of work moving forward. So there are a number of us who are part of this group, and you can see everybody that is within this group. Everyone's listed there. So we had a meeting in March, and following that meeting where we sort of realigned what our vision is as a group, and I think that's absolutely critical for us to actually determine what are we going to deliver so that we're coming to these meetings with some tangible outcomes, hopefully. We've then determined that our scope is to look at EPMA in all clinical areas and specialities, not just inpatients. And we're quite keen on that to make sure that we've addressed a breadth of areas. And how we not only look at the pharmacy medicines management workflows, but also look at patient safety across all care settings and link that back in though with the with workstream 3. We'd like to support the drive for standards nationally for digital medicines and support the development of digital medicine systems by communicating further with vendors, which we all feel, those of us that have been involved in EPMA deployments, sometimes can be one of the more trickier concepts to manage. So within our work stream, we've then what we've done is we've broken this down into a key number of sub work streams. I'm not going to go through all this in detail, but in essence, we've got clinicians' roles, workflows, and workflows that involve all clinicians, not just pharmacy. So we're very keen that we make sure that that workflow impacts everyone, whether it be a doctor, nurse, pharmacist, technician, and all other professionals, allied health professionals, etc. And it starts from the very first point in primary care, moving through the secondary care phase when a patient's admitted, and then that transfer back into primary care. A very heavy piece around benefits realisation. A number of us will have been involved in looking at benefits realisation within our organisations. The patient benefit, and there's obviously a lot of hot topic around user-centred design at the moment and how we can focus around thinking about our patients, the interoperability benefits, the financial benefits, and what are the barriers also to benefits realisation, and then some final work streams around quality improvement, optimisation of success stories, the patient's role, as I briefly discussed earlier, and the risks, but again, bearing in mind that that doesn't encroach on workstream 3, and then the maintenance and post-implementation of EPMA as well, which is in essence a lot of the reason why most of us have joined this group. So this is a report that we've kind of refined over the last month or so, with the view that we will then meet shortly in the next couple of weeks as a group to then determine which of these sub work streams we are going to work on. This is a huge piece of work, so inevitably we can't cover all this in one go. And even though there is 10 of us, it's obviously a lot of voluntary work that is ongoing to be able to develop this. And I'm very grateful to everybody who's been involved so far for their input. So our plan will be that we will share this strategy amongst our group, decide which initial sub-work streams we're going to kickstart with, and then create task and finish groups for each of those sub-work streams in order to develop those pieces of work with some very clear outcomes. In essence, our sort of major risk is that we're quite conscious that this requires a lot of time to be able to deliver this in a effective and efficient manner, and also be able to deliver some positive outcomes that we can then be proud to say that this is what we've achieved and the differences that we can then ultimately make for our patients and our staff. That's it from myself. I will hand back to Amita, unless Joseph, you've got anything additional that you'd like to add. Thank you very much.
Thanks, Ramandeep, and Joseph, and the whole kind of work stream. Actually, the work looks really, really great, and it's great to see how much progress is being made in this area. I think that the key topics that you've highlighted in the report kind of are really pertinent, and they definitely kind of really resonate with myself, and I'm sure lots of people on the call. So thank you for that. We do have a question, I believe, from Andrew.
I'm sorry, I'm being noisy today. It's because I haven't joined for a while. Really like the things you put down there. One question around the maintenance aspect that you put onto the list. Is the goal of that to kind of get a staffing or like a resource requirement list for people doing the implementations? Is that kind of what the thinking is on that one?
I'm happy to comment, Amita. Yeah, okay, lovely. Thank you, Andrew, for your question. Questions are always welcome, so don't worry about coming along and asking things. So in terms of, there's two elements, I guess, within there, and I'm happy to sort of add that in around structure. So we have talked about how many people, I guess, is required in order for teams to progress with EPMA. I think one of the maintain EPMA. I think one of the things that we haven't picked up, and it's probably possibly something we just need to decide, I guess, if it fits in any of the work streams or whether it fits within this, is that traditionally, I guess, a lot of our roles have sort of born out of being an EPMA pharmacist, those of us particularly that are within this sort of digital field, whereas now I'd like to see a culture change that it's not, you don't just be labelled as the EPMA pharmacist and then actually you get given everything else that's got a plug attached to it, pretty much. Let's be fair. I can see a few of you laughing, so it's pretty true, right? We all end up being, the printer doesn't work, the fax machine doesn't work,
it kind of needs calibrating.
Yeah, exactly. So my view would, dare I say it, they're almost, Amita, I'm not sure if I'm about to put my foot in it here by saying there almost needs to be a work stream that looks at resourcing, taking on Andrew's point, that actually is what is the ideal structure for supporting a pharmacy, digital medicines, like informatics team, or where that sits within organisations. I've probably said too much and possibly created myself more work. I'm going to blame you, Andrew.
Yeah, no worries. I can input on that as well. So I've had quite a bit of experience in this one, but I think it's well worth, I think, having there as a resource suggestion or as a resource estimating tool. From the implementations I've been involved with, maintenance is almost forgotten and people are so focused on just getting live, and then the business cases and the budget available to maintain your solution is significantly lower than usually what's required, and that's where you get a real pinch and then you end up struggling to succeed. So I think it's something where as a group we can probably input quite well and give an estimation tool that supports business cases in the future and what is the appropriate staffing level.
I completely agree, and I think one of the things that we had put within this was about creating a specification for, in fact, actually, we've got it there actually at the bottom. Do we create a set specification, set structure for digital medicines pharmacy teams? So we have actually put that in as a point. So clearly was already thinking ahead, hopefully. But yeah, totally welcome, I guess, people's opinions on that. And you're quite right. In business case I've recently written for EPMA, I put a BAU team in, and that's clearly spurred a number of hands to go up. So I think I'll hand back to Amita for the management of the hands. Thank you.
No worries, thanks. So I think it was Shazad first and then Jono.
Yeah, thanks. Thanks, Misa. I was just going to ask Ramani if she could fix my mouse because it's not working properly. The amount of times I got asked that question is unbelievable. Yeah, I keep saying I'm informatics, not IT, but that's another matter. But yeah, no, I just pick up Andrew's point. I completely agree. I think that's one of the things that we'd hoped from a digital perspective, that people are actually sharing those lessons, that you'd actually be able to say, well, actually, we carried out this implementation and we were told, you know, we would need only two pharmacists or an EPMA nurse or what have you, and that was sufficient, whereas clearly that's never been the case. And it's about understanding what the need is. And I think, like you said, it's not just an EPMA pharmacist, there's also the kind of integration piece as well, whether it's automated dispensing cabinets, smart pumps, barcode medication administration. There's a whole, you know, remit that we have from a digital perspective. So I think maybe and happy to contribute as well, because having done some of this stuff, but it may be worthwhile looking at the different systems that we're using, because I think due to the different types of functionality that's available, you may be able to utilize and optimize those in a better manner. So there are some places which maybe just be a kind of a basic EPMA and that's it. But then there's other places which may be like a larger EPR with like further functionality in terms of clinical decision support, dose-based checking, etc., and the order sets. So I think those are some of the key areas we may need to kind of look at as well. So maybe just kind of drilling down to that granular detail. I think that's what I was going to suggest. Thanks.
Thanks, Shazad. That's really helpful. And I guess just a point to say that there is loads of really great different areas that we would love to include sort of in the various work streams and in the various reports. I think we've taken quite a practical approach in terms of what can we feasibly actually include in some of these reports and some of these areas, but completely take on board comments such as you know, such as, for example, like the resourcing and business case. I think there's loads of really great areas that actually as a group we can definitely work on. So we are making notes of all of those additional areas. But we're also trying to balance that with kind of like what can we practically achieve in certain kind of timeframes and what can we kind of prioritise. But just wanted to reassure everyone that we are capturing the other thoughts as well. So I think we'll take two more questions and then we'll move on to the next work stream. So Jonathan and then Benjamin.
Mine's more a comment on that. I think the resourcing, from my experience anyway, as Ramandeep has pointed out and others have pointed out, you get a lot of resourcing from implementation and then it falls away for maintenance. But I would say from my experience that's more to do with the lack of knowledge, for want of a better term, within the NHS as to what optimization work is there and what it can achieve. And I think some of the resourcing will be better understood after the optimization piece work has been done, and also the CCIO working group as well, because it's not just the EPMA pharmacy team that needs to be looked at, and how does that work closely across data, you know, the scan for safety stuff and the implementation and the integration of everything, but it's also from a governance viewpoint. Do you need just a kingpin CCIO who just rules the roost, or do you need to have a structure underneath that? Where does the clinical structure, the clinical governance structure, fit in with that, and how do you prevent things like the pausation of any work to be done because you're so busy getting it through governance groups you can't actually get anything done? So it's kind of all that aspect as well that needs the resource, the resourcing will potentially fall out of, and we can give trust better guidance from that, in my opinion.
Yeah, definitely, and completely agree with everything you've said there. Benjamin.
Cheers, guys. Kind of 2 points really. One, completely agree with what Shazad and Jonathan said about, you know, it's not just EPMA. There are other systems. Here at Warsaw, we don't have EPMA currently. We plan to, but you know, again, pharmacy automation, ward-based automation, all those kind of technologies and how we apply them. And apologies to anyone else who's on the cohort for the at the Digital Academy, because you'll have heard me banging on about this, but I'm actually a pharmacy technician by background, and you know, we form a part of the pharmacy technician work, the pharmacy workforce, and I think there is a larger discussion to be had in pharmacy about the role of pharmacy professionals in a digital capacity. Anyone who's on the course has learned, you know, this year is the year of the digital professional. So what technicians, ATOs, and pharmacists kind of can provide into that. I'm kind of having very early discussions about setting up a kind of a pharmacy technician digital network for digital pharmacy technicians, because again, it's classic stuff of silo working and different areas that are excelling in it, and then there's lots of crossover with bits of data, bits of IT. So I think there is a lot of opportunity there to learn as a profession, really, about what are we doing as a profession going forward, and how are we going to use our skill set and apply it to this kind of new way of working.
Thanks, Benjamin, and that's really important. And I guess something that I think we're quite conscious of is also when we're talking about systems is around including like that whole pharmacy team, but also wider than that, actually the whole team who are involved in that digital medicines pathway, actually regardless of what profession you come from. And I've just seen in the chat box, actually, John has put, can we get any details of any technician networks as well? So actually, that would be really great, and perhaps that's something that we can link in with Ben, with Glennon, in terms of that first work stream, in terms of that networking group. So Ben, I have popped Glenn's email address into the chat box, but if that is something that you're interested in, creating that technician network, it might be a good place to connect with Glenn in terms of kind of enabling that and making that happen. So I'm sure he would welcome that too.
Yeah, he works down the road from me, and I know Glenn very well, so I hope so.
That's great. Okay, perfect. I will, in the interest of time, I will hand over to Jonathan for an update on Workstream 3.
Okay, I just share my screen. It's not quite as well presented as Ramandeep. Thanks for setting the bar so high. Oh, it's also disappeared. So for Workstream, rather than me spend ages trying to find what I was going to present, for Workstream 3, we are, as Ramandeep said, we're working closely with the optimization aspect of Workstream in order to work out the optimization is largely what can we do with the EPMA systems after implementation, and the safety workstream is, in essence, how do we do this and how do we manage this in a safe environment. We've managed to meet about 3 times. We've been hit a little bit around operational work over the last few months, and I think the risk that Ramandeep called out for her work stream, I think would be true of all work streams. This is quite a bit of work, and everyone is doing this on a voluntary basis. So I'm extremely grateful for those who come around to the meetings. But the risk is obviously trust operational aspects will take priority, so that needs to be taken into account. So the work stream itself, the last meeting that we had was last Thursday, and we had a very good discussion around the headings that we have within the document. We set up a document with Ramandeep and the optimization work stream to follow on from the optimization, and we've had a few headings. I've actually got them here. So validation, so methodologies based on our experience, so what would need to be utilized for validation, and that's something around the data as well. There's quite a dearth of information around how you would validate and what you would need to do to validate data within trusts. And depending on what the data is to be used for. We've also highlighted as a high point. Oh, thank you. That's brilliant. The hazard logs, what to be included, standardization of hazard logs to make sure that all trusts are speaking roughly the same language. I know there's the CSO training, and we get training in that, but there still seems to be a bit of confusion around those. Cautionary points from experience. based and focused on the risks and hazards that people around the table within the meeting have seen. And then downtime, cautionary skills around downtime, how how a good business continuity plan is written, what to be expected from a business continuity plan, etc. Decision support, as an example with these things like hard and soft blocks, etc. And then in addition to the governance section, which is to do with how do we manage and govern the data that we're getting out of them. I alluded earlier to the aspects of validation, etc. And then the governance overall, it's a balancing act. Just speaking personally within my trust, I set up a governance aspect within my trust after we implemented it, and I managed to create a process that meant that we had no changes at all, because it took so long to get through the governance system that nothing could go into an EPMA system. So there's clear balance between being able to put stuff into the system and utilizing the system and getting the best out of the system in a relatively quick turnaround, but making sure that that is safe. We also have staff management, and it's to do with capacity and how the digital systems can support capacity and can aid with the way in which staff are working in a more efficient manner, all the way through to the education of staffing, non-digital staff in particular, how much we would expect a non-digital member of the team to understand what we're trying to achieve and understand how to work in a digital setting. And then we also put in the environmental sustainability as well, around the ability to impact on that environmental aspect of it. The discussion that we had last week, two key sort of things came out of that. One was to do with the scope of the actual meeting and work stream, and a scoping statement is very much needed. So we have a choice really of a very wide scope, where we go all the way back to procurement and what we'd expect from a digital system and what we would expect from a pharmacy professional within that procurement process, running through the implementation, running through optimization, or whether we focus purely on the optimization work and how best to achieve the optimization work. And that's something that we need to discuss at the next meeting and pull together an appropriate scoping statement for that. And then also we had a bit of a discussion around the role of the pharmacist in this and how much we focus our attention to the pharmacist. As with the name of this group, it's the digital professionals, and medicines management processes are all professions will be involved in, but it also mustn't be forgotten that when the chips are down, it tends to be the pharmacist that gets the phone call at the end of the day for medicines management processes. So they are a very key part of that process, and the pharmacy team support medicines management more than probably any other profession. So we must reflect that in the document as well. And I'd be keen to hear people from this group's thoughts on those two aspects, whether we should narrow the scope or keep it wide and produce a wider document, or whether we should have, and how much we should reflect the pharmacist's role, or the pharmacy team's role within that medicines management processes. I think I've captured everything from the last few discussion and given a very quick whistle-stop tour. The next work would be to review what we've got so far. I'm quite keen to get a dynamic document in place where the team can actually edit and look at that as in between meetings, and we can then review at the meeting, and obviously then produce, if needs be, produce task and finish groups, etc., from our work, from our cohort of members, in order to drill down deeper into certain aspects of this. And that will be the main focus over the next few meetings. So any questions at all on that? I've done well. Either that or my mag's off, one of the two.
You've got off lightly there with no questions.
Have I bamboozled everyone, or
Oh,
we got one. We've got
one question. Shazad.
Thank you.
Thanks, Jonathan. I think that was really useful update. It's just a comment around you mentioning about this being a digital medicines professional interest group, and within the documentation, do we, call that out explicitly, or do we kind of incorporate other professionals? And I think we need to emphasize, like you said, that pharmacists and technicians, as Ben's mentioned as well, are key component of that medicines management group and do engage on a regular basis. However, as we'll see in everyday life, whether it's the nurses, whether it's the doctors as well, they have a significant part to play. And I really like that whole idea of us having that collaborative joint working effort. I think we just need to, what's great about this group is we've managed to see a lot of people who've really taken a lead and really been like, innovative leads throughout their organizations and have been recognized as such. And we need to continue doing that, because I think a lot of professionals have gone a lot further in that regard. But it's great to see that there's quite a momentum here. I think if we kind of emphasize the skills and expertise and knowledge that we have within the pharmacy professional group, we have technicians, ATOs, pharmacists, but also the fact that our colleagues whether it's the doctors, whether they're nurses, whether they're physios, etc., they have a significant part to play. So I think it's useful to call that out as well. That's the comment I wanted to make. Thanks.
That's a really good point. Thanks, Shazad. And yeah, I think there's balance there, and I completely agree. It would be really good to have that wider approach and to incorporate all of those different healthcare professionals into our into the thinking for our work. So thank you for that. Anna.
Hi. What I want to also add to this is not only professionals, is we have as a faculty also got a digital safety group, which is obviously then aligned with the digital safety officers. And I'm wondering how, actually this group actually works with that group and makes sure that digital medicines aligns with digital safety across the board. Medicines are just one part of our digital safety of a system. So we need to ensure that, and I think one of the priorities I would say is to educate the pharmacy professions or professions dealing with digital medicines to know that there is that kind of underboard requirement, legal requirement or standard that we need to follow, which brings us in to make sure it's a safe system. So it's understanding there is a process in place as well. So it's not much about education there or training, and our links in with other professional groups that are looking at digital safety. So any comment on that?
That's an excellent point, Anna. Really, really good point. And I wonder actually if perhaps through Ben or through Jan kind of centrally at the FCI, whether we can find that way to connect in with some of those wider groups, because I think it will be really helpful actually for that two-way learning, where we can learn from their groups, but actually their groups can also learn from our work stream. So actually perhaps that's something I might pick offline with yourself, Ben, and also Jonathan, in terms of how we can connect that together. I hope that sounds okay, but thank you so much for that nudge, Anna. That was really helpful to hear. Lastly, I will just move on to the fourth work stream, which is a pharmacy specific work stream, and that's around a pharmacy pathway to CCIO. And I'll just quickly share my screen. I'll just very quickly talk through this. So essentially, again, created a bit of a base for document in terms of our vision and what we're aspiring to do in this work stream, and that's really around encouraging and empowering pharmacists to aspire to be CCIOs and providing that bit of a career pathway into it. And really this piece of work is based on the FCI's model job description and around kind of like the 6 pillars that are encompassed in the main duties. And we've just tried to formulate some levels, some capability statements and some example experiences for each of those 6 different domains. I don't want to, I won't kind of go into it in too much detail, but I just kind of wanted to give you all a sense of where the thinking is so far. Although just to caveat that to say that actually it is in very early, you know, it's still in very much a draft format, and actually what I'm hoping to do so far is that's being sent out for comments to about 5 or so people who are interested in Workstream 4 to kind of get initial thoughts and comments back on the approach and whether that's suitable for our aims in terms of what we're hoping to do. So that's kind of really where we're at the moment. I guess just a plea to this group is that it'd be really great to kind of sense check that with other people who are also interested in that work stream, particularly if there's anyone on this call who is already working at a CCIO or CPIO or similar sort of role. If you're already working in that capacity, it would actually be really helpful to kind of gain your insights into that. So if you're able to drop your email address into your chat box, into the chat box, and then I can forward on that documentation to yourselves. So that would be really helpful. And I've just seen in the comments box something from Anna. So can we be careful with documents that are looking at pharmacy professionals working towards chief digital roles and not just pharmacists? So yeah, that completely take on board that. So I think that's basically saying that actually pharmacy professionals might want to look at wider digital roles and not just pharmacy specific digital roles. I hope I've got that understanding correct. So yeah, completely agree with that. I think the aim of this workstream is really for pharmacists who are perhaps at the beginning of their career journey. I think it's really to try and provide some opportunities or some thinking as to where they might want to be able to develop themselves into aspiring to become, for example, like CCIO. But again, that could be relevant across other kind of senior leadership digital roles, if that makes sense. That's all I wanted to say really on Workstream 4. Did anyone have any questions or comments around that? Jonathan?
Just writing it in the chat, but sometimes it's easier to say it. I think it's a brilliant piece of work, and it's a very timely piece of work. And I think pharmacy as a profession needs to understand that there are these other routes through a career of a particular individual. I think we've been quite slow as a profession to pick up these other opportunities, and it's not just in digital. There's other, other examples of this. We seem to be, and forgive me if I'm out of date or incorrect or whatever, but we seem to be quite focused on a very narrow pathway through a particular hospital. And that's reflected in how the other professions are thinking and also how we see ourselves. And I think all that culture needs to be reviewed as well. And I don't know how best to achieve that, but yeah, I think it's important.
Yeah, definitely. I think there's that idea that actually career pathways have to be linear. They have to be like a straight line, but actually we know that it kind of goes left, right, up, down, circular, back left, back right again. And actually there's loads of different pathways to achieving a particular position. So I think that's really important to capture.
Very bizarre, a very bizarre appraisal with my line manager about how we were going to plan to get me out of pharmacy, but you know.
Oh gosh, yeah, bizarre. Jonathan, I think is, no, yeah, thank you. Eugenie.
Thank you. I think linked to that discussion about career pathways and so forth, I wonder if this group should also be thinking, or that work stream should be thinking about consultant roles in informatics, because there's a big drive about clinical pathways, but there are also niche specialist roles of pharmacists speaking as a consultant medication safety pharmacist, for example. Why isn't there a move towards clinical informatics consultant pharmacists? So I think that's something definitely that group should be looking at. Declaring a vested interest of, doing more informatics, I need to now move into the space of a consultant informatics pharmacist rather than a medicine safety pharmacist. But nonetheless, I think looking at everybody on this group and the number of pharmacists that are operating in this space, I think that's a real need. And thinking more broadly about FCI and its development, I think that was one of the reasons that the whole FCI faculty model came about, is because in the medical space, there were questions being raised about what is the consultant practice, and your consultant level practice is in informatics, actually. So I think we need to push that agenda on the pharmacy side as well.
Yeah, excellent point, and really, really helpful prompt actually to kind of widen that, to kind of just widen that scope. And it'd be interesting actually to see kind of what frameworks we can use, the role of the RPS framework as well within that. So I think really important factors to consider. Ramandeep and then Andrew.
Right, thank you, Mita. And just picking up on Eugeni's point, it's really interesting actually. I've always had this vision that I would be a consultant pharmacist in digital innovation and clinical informatics, but Eugenie, I agree with you. Then the challenge of how to get there has always been one that's been met with perhaps resistance, or we have no idea how we can support you to do this. So where have you come up with this idea from? And it's very much I've like something I've made up, as it were, and kind of in essence given up trying to do that because of the lack of a framework or something to work towards. And I think that's a real shame. So would totally support some form of trying to pursue something within that field, because I think it's really, really important, and I'm really glad that someone else has sort of felt the same way, because I've just gone, okay, that's never going to happen, and try to in essence move on with my career. But maybe that wasn't the wisest move, and hopefully as a team together we can try and do something about it and support each other.
Thanks, Ramandeep. Really resonate with that. Andrew?
Hi, I just want to say that with the implementation team I'm working on, we have 7 pharmacists, only one of which is actually working with pharmacy itself. When the implementation group, whenever we interview people, pharmacists and pharmacy career professionals seem to have an affinity for digital implementations and understanding hierarchical and highly organized systems, particularly following protocols and processes. So as a profession, we lend ourselves to clinical informatics and digital implementations very well. And so I think this work stream is essential to help try and create those frameworks, because every one of those people I work with has found their own way into it through their desires rather than following a process.
Thanks, Andrew. Shazad, we've only got a couple of minutes, and we have got 2 other things that we just wanted to mention, but we can take your but yeah, happy to have your question.
It's just a point that I think it's really good that Andrew mentioned this, and everyone else, and I'd echo those sentiments, saying that there's different pathways to come in, and there are people who are maybe not as affiliated with pharmacy anymore due to the digital informatics arena they work in. Just wanted to say, one of the things I've learned from the CCIs I've worked in the past, he mentioned just is the ability to work clinically is also really a core component of that informatics knowledge as well. So yes, go by all means, go into the digital side. Go informatics is really, really useful. However, the fact that if you are working half a day or a day clinically at some point as well on a regular basis, it gives you the ability to say, I'm using these systems in earnest. These are the challenges I've faced. These are the benefits I've also accrued as a result. You always tend to have a lot more integrity. And it's just something that he mentioned in the past, and I thought it's been useful, and it serves me well, and I know it's served a lot of other clinicians as well. So I just wanted to reiterate that.
Thanks, Shazad. That's really helpful to share, and I can see some thumbs up from the group as well. Just a couple of other things that I wanted to mention. So just wanted to kind of well, I'm sure you're all aware of Jonathan, who leads Workstream 3 at the moment in terms of the safety group. Just wanted to mention that I will be on leave for the next few months, and Jonathan has kindly agreed to kind of chair these meetings in my absence. So if there is anything that people on this group need, please feel free to kind of contact Jonathan as the main point of contact over the next few months. And just wanted to say thank you again to Jonathan for agreeing to do that. It's really much appreciated. So yes, I just wanted to say thank you for that. There was one item from Jan in terms of any other business. So just a reminder for people who want to provide feedback on NHS England's standards and interoperability strategy. That consultation closes at midnight on the 31st of May, and there's a link in the chat to the Teams group to how you can access that. And Ben, sorry, did you have your hand up?
Yes, we've got a couple of pieces of AOB. First of all, I'd just like to thank you for all your hard work. I know a lot of you are doing lots of great projects and these work streams are brilliant, but just thank you, Amita, and good luck, and we'll see you when you come back. And I did mention earlier, sorry, I was on autopilot, that could I record this meeting to make sure my notes were correct, but of course we'll be putting it on the faculty YouTube channel anyway, just to correct that, so apologies for any confusion. And my colleague, Lorenza, has a bit of...
Hi everyone, I'm Lorenza, I'm the education and the training lead at the faculty. I just wanted to very quickly let you know that we have 2 education projects now for which we are recruiting volunteers. So one of them is a working group for professional development resources. The faculty has received funding to develop learning resources for early career clinical informaticians, and we're putting together this working group. Of course, it's very important for us that the working group is multidisciplinary. So I'm here today just to ask if any of you is interested in being part of this working group. Can you please, maybe, I don't think any of you have my email address, but maybe you can send an email to Ben and then I can forward it to me. It would be great. Or if you have any questions or any input you'd like to give me, please just don't hesitate to get in contact with me. We're also looking for volunteers who are going to trial a portfolio prototype, and I'm happy to trial it and fill up a survey. So again, if you'd like to know a little bit more about that, or you'd like to volunteer with this project, if you can get in contact with Ben, who is going to forward your information to me, would be great. Thank you so much.
Brilliant. Thank you. Thank you, Ben, and everyone. Apologies for being a couple of minutes over. I know lots of you have had to leave, but just wanted to say thank you again to everyone. Great work that's been going on across all the different work streams, and great input from everyone in this chat box as well, and with the hands up functionality. Great to hear from everyone, and yeah, look forward to hearing from everyone soon. All right, thank you all. Take care. Bye.
Thanks. Bye.